Panoramic radiography can be a tough subject to learn, especially for new dental students. Its geometry is pretty complex, and to really understand it, we need to understand what tomography is, because panoramic radiography is a form of tomography. So this video is going to cover tomography and what the focal trough is. So first of all, what is tomography? Well, understand that radiographs contain superimposition of structures. And tomography is any technique that removes overlying structures, and it does this by movement. And so your conventional tomography is simultaneously moving an X-ray tube and the film in opposite directions during the exposure. What that does is it makes things that are further away from the object you want to be in focus blur, and same things with things that are closer than the object. Here's an example of what I mean. So this is the parallax principle. It looks like our eyes are moving back and forth right to left, correct? And so imagine your eyes are an X-ray source. And now imagine you want to image that yellow cube. How would you place, or how would you move a sensor in relation to the moving X-ray tube in order to make that yellow cube stay in focus, and everything else is going to be blurred and stretched across as it's passing in front of and behind that yellow cube? If you line it perfectly in sync with that yellow cube, everything else is going to be just kind of blurred across the rest of the image. Here's another example of that. Here, this just shows 3 image locations. But imagine you're acquiring this image the entire time it's moving from this initial position across here to there. This is the tube head, right? And this is the sensor. So when you start, you have where's the purple dot? It's indicated by F, the part you want to remain in focus, or the focal trough. It's right in the center of the image. And so something closer to the source is labeled X here, something further away is labeled Y. When it starts, X is over here on the right side and Y is on the left. As it's moving through here, and you're moving the sensor in the opposite direction, so to the left, while the X-ray tube is moving to the right, in the center location, they all superimpose each other. So here we have X, F, X, Y, all in the center of the image. But here as it gets to the right side, now look what's happened. Where's the X? It's on the left side. So it's swapped positions. And same with the Y. It went from the left side to the right side. And so the only thing that gives you a consistent image throughout this entire exposure is that inside the focal trough, or in this focal point. So think of that as the point of rotation. And that makes this F very much in focus, and other things just blurred around it. So that's your conventional tomography. And so this is an example of conventional tomography. They used to do this much more frequently than they do now. Nowadays we have 3D imaging with cone beam CT, and if we want to look at the joints, we'll typically default to a cone beam CT. But back in the day of conventional tomography, you could get a fairly good view of the outline of the joint. You've got the condyle here, you've got the articular eminence, the glenoid fossa right there. And this is a lot better than it would look if you've seen a cephalometric projection. You get a gross view of the joints, but you don't see as much detail, even though this is somewhat blurry compared to what we're used to. This is a lot better detail than you would see in just a standard cephalometric projection. Okay, so how does that apply to panoramic radiography? Well, it's the same kind of thing. We're trying to move the tube head and move the sensor in different directions, but such that the teeth remain in focus. Of course, you're going to see the sinuses, you're going to see the bone, which we want to see as well, both the maxilla and the mandible. And so this is achieved as it rotates around the patient. Instead of just going in one single direction, like I showed you in that parallax slide, both of these are rotating around the patient. See, the X-ray source is rotating counterclockwise, and this is rotating counterclockwise. If you're looking across from each other, you can think of that as the opposite direction. And then what is this showing? This is showing a collimator that's only exposing one slit of the image at a time. And as it's doing that, it's moving the receptor past this collimator at a certain pace, or a certain rate, that keeps these teeth in focus, just like we saw with those F, X, and Y dots, where the F was the only thing in focus. And so you can choose the rate of movement past this collimator to put certain things in focus. If you do that at the exact same rate that is going to be passing across the teeth are going to be in focus. What about structures on this side? Because it's got to pass through all those structures, but those are moving the opposite direction and they get blurred. To maybe hopefully simplify that explanation, let's think of the patient as just a disc. And now instead of moving the X-ray source and the receptor, we're going to assume that the disc is rotating. And if you understand physics, it all has to do with your point of view, right? Whether the patient is rotating or the source and the receptor are rotating, the physics is going to act the same. So to simplify it, we're assuming we have this rotating disc. And actually some of the first panoramic radiographs they had the patient rotate. They would sit in a rotating chair, and the patient would rotate as it was exposing. The X-ray source was stable, and then they just had a collimator with a receptor that moved past that collimator at a rate that was equal to how the teeth would be moving past the receptor as well. And so just like with that, if this disc is rotating, if you move the receptor past the collimator at a rate that follows ABC precisely, then A, B, and C are going to be in focus. What's going to happen with F, E, and D? They're going in the opposite direction. They're actually going to be reversed, but they're going to be blurred. They're going to be hopefully unrecognizable. So here's a thought question for you. What if you moved A closer to the point of rotation? How fast is it moving relative to the receptor? It's now moving actually slower to the receptor, so it's going to be spread out horizontally. This A would look really wide, as it would take a longer time to pass through the X-ray beam as it's going through the collimator into the receptor. Conversely, what is true? What if you moved a structure closer to the receptor? Then it's moving faster. It moves so fast, it's going to appear actually shrunken. And so closer to the point of rotation means it's widened. Closer to the receptor means an object is going to be shrunken. And you'll see that when we're talking about positioning errors of a panoramic radiograph. Okay, so this just shows the true geometry, because we know the patient doesn't sit in a spinning chair for most of our panoramics. Although that would be fun, we could make him put a quarter in it, maybe a little extra source of income for dentists. But no, the patient doesn't move. The X-ray source and the receptor move around the patient, but it's all the same principles, right? This collimator is moving, really, so the receptor moving past the collimator at a rate in which the structures in A, B, and C are going to be in focus. Now, instead of A, B, and C, we want to talk about actual anatomy, and it's the teeth that you want to remain in focus. And so this is all done just so that the timing is such that the A, B, C, where the teeth are, the teeth line up perfectly with that receptor as these things are going around. Of course, it rotates not quite 360 degrees, but most of an arc around the patient. This is as if we're looking down on the patient. You can recognize the mandible here. And most of the machines, at least the ones I know, they do start with the X-ray source out in the front right of the patient. And that means the image starts with the patient's left side. And if done correctly, it should start behind the condyle. And then the first thing you image is that left mandibular condyle. And then the left mandibular body, the teeth as well. And then right here, this would be what? The midpoint of the image. You've captured half the image. You've captured the patient's entire left side. And then it would continue going around until it captured the right side just the same. And so what are these V-shaped, this inverted V of black dots? Well, this is showing the point of rotation. When it first starts, the point of rotation is back here. So why would they have a moving point of rotation? And the reason for that is if you had just a static point of rotation, your focal trough would be circular. And our patient's jaw is circular? No. They're U-shaped. They're kind of parabolic. And so that's why this point of rotation is moving, so that you can have this arch of structures that are in focus. Also, ideally, it's going to create open contacts. Helps us diagnose. So I just explained that. What do the dots represent? That is a moving point of rotation. And why are they in that V shape? It's to create this right here. This is what represents the focal trough. If done correctly, it is going to be centered right on the dentition, so the teeth remain in focus. All right, so what happens with anything that's outside this focal trough? Well, it's going to start to be blurred, right? We said something closer to the point of rotation, it would be what? Widened or shrunk horizontally. It's going to be widened if anything is closer to the point of rotation from the focal trough. If anything is closer to the sensor, it's going to be shrunken down, because now it's kind of moving past the image sensor at a faster rate. You can also think of magnification, right? Closer to a source, it magnifies. So if something's closer to the point of rotation, it's going to be magnified. And if something's closer to the sensor, it's going to be minimized. And this is what I'm talking about with image magnification. What's creating magnification here is because this cardboard cutout is closer to the source of light. You get closer and closer. Imagine pulling that in. I could do this experiment and shine a shadow of my hand on the wall. As I move my hand closer to the flashlight, what happens to the image on the wall? It gets bigger. If I move my hand closer to the wall where the image is, it gets smaller and smaller. And that has to do with divergence of the beam. In this case, a light beam, but in the case of our radiographs, it's an X-ray beam. And what do I mean by divergence from the source versus divergence of center of rotation? This is source, right? A source of an X-ray beam. If you're talking about just standard radiography, you're talking about the source of the X-rays, And you can also talk about magnification because that's an important concept as well. But when we're talking about panoramic radiography, the horizontal magnification actually comes because of that point of rotation. You can think of that point of rotation as where the X-ray beam is spreading away from. And so because that value is smaller, magnification is going to be exaggerated in the horizontal direction. And these next images kind of show what I mean by that. Okay, images A and B. This shows a patient aligned correctly in the panoramic machine. The teeth should be in this little notch. And this metal ring, which you can see is round, it ends up looking pretty much in focus, pretty much properly proportioned. Not perfectly, but it looks pretty round. And the teeth look properly proportioned as well. We said if something is too far behind the focal trough or too close to the point of rotation, it's going to be magnified. And I talked about the difference of magnification between the source, the X-ray source, versus magnification in the horizontal direction is caused by the point of rotation. And so it's exaggerated horizontally. And that's why this looks oblong. You notice the edges are starting to be blurred. But what happens if there's an object that lies too far anterior to the focal trough? So this notch, again, that's where the teeth should line up. This shows where that focal trough is in the X-ray image. And if an object is too close to the sensor from the focal trough, we said it was going to be shrunken down. And it's exaggerated horizontally, that's why it looks oblong. But it's really more just shrunken horizontally. You can see that with the teeth too. I didn't point out this one with the teeth magnified and stretched out horizontally. But if it's too far forward, they're shrunken down horizontally. All right, again, think for yourself. Was this patient positioned too far forward or back? And this one's an interesting one. If you look at the maxillary anterior dentition, they look roughly in focus. They look properly positioned. But if you look at the mandibular dentition, they look widened horizontally. What does that mean if something's widened? Remember, if it's closer to the source or closer to the point of rotation, that's when it's widened. So this is set too far back. If you have the maxillary teeth that look normal and in focus, the mandibular teeth too far back, this is probably what type of patient. What's their bite like? Well, they've got a severe overbite. This might be a class 2 patient where the mandible is deficient and it's set too far back to be within the focal trough. And you also get blurring because of that. It looks like we've lost the apices of this tooth. A lot of times the incisors flare outward. And so the apices are going to be affected even more to the point of non-recognition here because now they're just blurred outside of the focal trough. And how about this one? Do these teeth look normally proportioned? They look a little bit shrunken, a little bit squished horizontally. And what does that mean? Too far forward or back? That means the patient was too far forward. Their face, their anterior teeth were too close to the sensor. And that's what causes that appearance. Here's an interesting one. What do you notice about the proportions of these teeth from the right to the left side? On the left side, they're a lot larger. So that means the left side was closer to the point of rotation. The right side, it looks shrunken. The teeth look shrunken horizontally. So they were closer to the sensor. And so I would say as long as you recognize that this is rotation, the second thing I would do to say which way is it rotated, you can look at the midline. And this is the midline of that image. You can tell they're just totally rotated to the right. Does that make sense? That you see these teeth wider and these teeth narrower if they're rotated to the right? If my midline is off, everything's just kind of shifted over to the right. That means the left teeth are closer to the point of rotation. The right teeth are closer to the sensor. It's going to be a little bit different if you see this appearance of the dentition and the center line is still right in the midline of the image. That means they were still biting in the midline. But to bite in the midline and have head rotation, that means I kind of have to rotate from the back of my head. In that case, if the left teeth were wider and I'm rotating from the back of my head, which way does my head have to rotate for the left teeth to be closer to the point of rotation? Well, it actually has to be rotated to the left. So interesting concept. If that doesn't make sense, think of it for a while. Maybe not the most important thing to understand. If you can look at this and recognize the head is turned, then you're where you need to be. And so that really just covered the first point in my 3 panoramic principles, the focal trough, and understand that an object closer to the source is going to be magnified, an object closer to the detector is going to be minimized, and that magnification minimization is going to be more exaggerated in the horizontal dimension. And then next I'm going to talk about lingual objects and ghost images in panoramic radiography.